been said that my name is Mwanakarama. I work with the Department of Health, Mombasa County. I coordinate reproductive health services. This January, as we all aware that it is Cervical Cancer Awareness Month. And this is a global health event whereby it is being observed in the entire month of January in each year. And the aim of this Cervical Cancer Awareness Month is to raise the awareness globally so that each one of us has the correct information about cervical cancer. We overcome our myths and misconception about cervical cancer. The theme of this year, Cervical Cancer Awareness Month 2024, is a slogan is to be involved in the advocacy. So today I'm here to take you through the general overview of the cervical cancer and also about the profile of Mombasa County in terms of cervical cancer screening and treatment, and where are we as Mombasa County in terms of screening and treatment, and of course, what are our roles and what are we supposed to do as Mombasa County when we are fighting cervical cancer? Cervical cancer worldwide, it is ranked number 4 in both among all the cancers incidences, in both incidency and mortality. Almost 600 cases. There are diagnosed new cases for cervical cancer. This is a very high number. And we have around 300,000, more than 300,000 deaths which happen annually. This is globally. And 90% of these deaths, they occur in the low and middle income countries. Remember, sub-Saharan Africa and Kenya is among these, of course, Mombasa. And in Kenya, this is the leading, it is the second most common cancer in women. And it is the leading cause of death among the women. So this, it is something which needs to be given a priority, because we are losing a lot of women as when it is a number 2, and when you are with cervical cancer, so the fertility rate is very high. And the age which is mostly affected is around 40 to 41 years. We need to know what is cervical cancer. When we say cervical cancer, what do we mean? When we say cervical cancer, we mean that there's growth of abnormal cells in the lining of the cervix. For the cervix, for those who don't know about the cervix is the lower part of the uterus that connects the body of the uterus to the vagina. Nearly all the cervical cancers, they are linked to HPV, human papilloma virus. And actually, if this human papilloma virus affects somebody, most of the time the body clears itself out, but around 2% can be persistent. And this persistence, if not identified early, it can develop to cancer. Then we have the vaccine, HPV vaccine, which can prevent up to 90% when given timely. This is the age between 9 and 14 years and in 2 doses. Then this is given to our girls. And the beauty thing about this, it is 100% preventable when identified early through regular screening. We have to know about the facts about cervical cancer. And we need to know this so that as we have said that we need to overcome our myth and conception. So as we've said that this is the number of new cases being diagnosed every year for cervical cancer is just too high, 600, almost 600,000. And in every 2 minutes, we lose a woman for cervical cancer. And we should also occur in our setup. And we have many types of cervical of HPV, and the mostly one which affect almost, which can cause almost 70% of cases, this is type 16 and type 18. When we can detect this early and treat, we can prevent between 80% to 100%. We have a lot of myths about cervical cancer. We need to know this. We need to differentiate between the myths and get the fact. So sometimes some people, they believe that cervical cancer can't be treated. Of this is not true. And the fact is cervical cancer can be treated effectively if detected and diagnosed early. HPV infection is unknown. Some people, they say it is uncommon. It is not uncommon. It is very common, and it is transmitted via skin-to-skin contact, body and above. They need pap smear
Manakarama, there
regularly.
is some voice that's breaking up. Huh? Please note on your side. Okay.
So I think I'm almost near the barabara, then I need to shift somewhere else. Huh? Do you get this voice again? Dr. Adam?
It's okay now. Your voice was muting, so it's okay now. Much better. Thank you.
Okay. And some people, they also think that when they are told that smoking is a high risk factor for cervical cancer development, they don't believe. But the fact is, smoking increases the chance for cervical cancer development. Then, as we've talked, that we have a lot of myths about cervical cancer, and here we have some of the myths. Some women, they believe that when you have the vaccine, you don't need to have screen for cervical cancer. This is not true. The fact is regular screening is very necessary, whereby the HPV vaccine, it can help to detect early changes in the cervix that may be cancerous. And another myth is somebody can think that getting a pap smear is extremely painful. This is just a myth. It is not. This is not true, as although the threshold for pain vary from person to person, but cervical cancer screening procedures or tests, they are not as bad as people anticipate it. And for a full screen of cervical cancer takes very few minutes. So even if there is pain, this is very temporary. And another myth is about older women don't need the screening. As we have said earlier, that they need screening up to 65. And if your results have shown any abnormalities, or unless you talk to your doctor. Then another myth is if a person has one sexual partner, they don't need to get cervical cancer screening. This is just a myth. As because the fact is HPV or human papilloma virus is not like the other sexual transmitted infections, whereby the symptoms they are shown immediately. But this one can be very dormant and stay there, and if undetected, they can cause cervical cancer. We have the Elimination Global Strategy by WHO. This is 1790. The strategy says that at least 90% of our girls should be fully vaccinated with a HPV vaccine by the age of 15. As we have said that it can prevent up to 90%. And for the women of targeted population, this is the age of 25 to 49. 25 to... Hello? The targeted population 25 to 40. Yes, Dr. Adam.
It's Edward. Kindly, Edward, please mute yourself.
So at least 70% of the targeted population, this is 25 to 49 years, should be screened annually with a high performance test. Then when these women are identified with a precancer, at least 90 of them should be treated with the precancerous lesions. And if somebody is having invasive cancer, should be managed appropriately, 90% of them, and palliative care should follow or should be in place. So What is our profile in terms of cervical cancer as Mombasa County? We have our targets and the eligible population or the targeted population. These are women aged between 25 to 49 years. They're supposed to be screened annually. We are at 50,674. This number we get from calculating. We have a formula whereby you get the catchment population, and from there you get the female. When you get the female number, there is another formula, and if you get also the women of reproductive age between 15 to 49, you can calculate to get the number for women between 25 and 49. Then this is for annual, and we can just calculate it dividing by 12 to get the monthly target. The same time, you can also go further, do even per week and even per day. Then you can be sure of achieving our target. Then the screening, we have methods like VIA, which are done in all the public health facilities, and HPV testing are done in 2 facilities, Portrees and Coast General. Pap smear is done only in Coast General. This does not limit other facilities not to take the specimen. We can take the specimen at the lower facility or any other facility, then we take it to Coast General. It is transferred, it can be taken there, then we get the results. When it is done, the specimen is taken from the public facility. They are free of charge. When you go to Coast General, you might be charged around 500 shillings because of their policy. Then what about our diagnosing? Our turnaround time in Mombasa for biopsy is around 2 weeks, and the treatment devices we have 4 lip machines in the county, 3 colposcopy machines, 5 cryotherapy machines, and 12 thermoablation machines, whereby 10 are in the public facilities and 2 in the FBO, the Catholic facilities. We have 1 oncologist, gynecologist, who is based in Coast General. Then what about the distribution of our healthcare providers who have been capacity built on the cervical cancer screening and treatment? We have done the screening for 206 healthcare providers. These are the lower cadre, and all of them are practicing. This is 100%. For the cryotherapy and the thermoablation, the same number, and all of them are practicing. Then for the lip machine, this is for the higher cadre, the gynecologists, around 5 of them, and 6 more. We have them 11, and all of them are practicing. Then for colposcopy, also for the higher cadre, we have trained 10, and also all of them are giving services. We are at 100%. For cytology, we have 1, and she is in Coast General and practicing. Then for histopathology, we trained 4, 1 went for training. Then we are at 75 during the service delivery. So where are we as Mombasa County in terms of screening? So as I can start explaining where we were behind in the years 2017. From 2017, the screening was at around less than 20%. So most of the strategies have been in place. We've advocated, and we have really talked about cervical cancer. And for here, I have tried to compare between the same quarter. This is the Q2 for 2 financial year. The last financial year, 2022-2023, Q2, we managed to go up to 35%. Remember, we had to meet around 70%. So we are halfway. So this financial year 2023-2024, we managed to reach 46%, but we still need to improve to reach 70%. At least the targeted population should be screened 70% of them. For the positivity rate, we are at 2%. This is acceptable rate. Then we've been compared the treatment. We've compared the same quarter, the 2 financial year, about the treatment rate. This treatment rate was very low from that time. I've said between 2017 and 2018, we were at around 2%. So we've really tried to bring things in place, to bring things on board, and involve everybody so that the treatment can be done as the way it is supposed to be. For the last financial year and Q2, we managed to reach 32%. For Q2 this financial year, we are at 55. Remember, we need to go to 90%. Why are we having this low treatment rate? There are so many challenges we are coming across, and we are trying to address one after the other. And for those low-hanging fruits, we go them very, very fast. And for the others which are persistent and very chronic, we are trying to encounter them. So one is the documentation. Those are challenging documentation. Sometimes you can see a treatment has been done somewhere, but